Wisconsin has, I think, taken a rational approach, at least legislatively, to the dismantling by administrative order or whatever of Obamacare. So if you just think about it, very bipartisan, created the reinsurance pool, meant to stabilize these exchanges and individual rates. Legislation introduced and passed out of the Assembly that would have preserved the pre-existing condition, exclude the prohibition on underwriting pre-existing conditions, as well as other using other health status. So I say all that because I think in the state, even though we have a legislature that at least right now seemingly is in the majority against the ACA, also understands that you can't just let it implode and fail. Because when the court repeals Obamacare, the court is not replacing Obamacare. And that is critical. If you're going to do one of the R's, you got to have the other R with it. And sometimes that other R means repairing, not replacing.
What we first would have to do is define what we want pre-existing conditions to look like in Wisconsin. What are they? And then what sort of stabilization program can we collectively support that will provide access to care for people who have pre-existing conditions, but will not price access to care and insurance out of the market for people who don't. And that's not an easy task. But we have a history of taking a look at what's important to us and how can we get there. That's the reason that we have one of the most competitive health insurance marketplaces in the country, some of the highest quality in the country, and have been leaders in Medicaid and other important programs that affect people who live in Wisconsin.